Thank you, Policy Circle, for once again inviting me and sharing my views and observations. In the morning session, when we heard about the lung disease, I just want to start. How many of us are aware about our lungs? I think the answer would be no. Till the time we had some respiratory ailment, we don't feel we are breathing. We don't, what we are respiring, we don't know. We are not aware about that. Unless you are a yogic person and daily do pranayam and other thing, then you will be aware about what you are breathing. It's all autonomous. Automatic things happen unless it is infected. The second example is if you are, I am a survivor of Bhopal gas tragedy. I know what lungs are and how lungs are important to your body. That's another thing. And most of us, we are all COVID survivors because the Omicron virus has touched the lives of everybody. So it has not spared anyone, either clinical, subclinical. That's why the maximum things have happened. During the first wave, when the thing started, we were all having experience of SARS and the MARS. As a result, we were very much skeptical what we would be doing when this COVID comes. And there were a lot of things, how to protect the lungs. A lot of discussions and other things have happened. I'm trying to just emphasize on the importance of the lungs and why it is very important, because unless we become aware about the lungs, it's all just as a routine we are talking about. We have to protect on the World Lungs Day. We have to be aware about the lungs in our day-to-day things. Both respiration is not left to us. If the higher conscious, if that's left respiration to us, we would be only taking breath as and when required. You see the consequences of that. We are very conscious about the fact, and I would be just highlighting what the government has been doing about that's a question which Lotto has asked me. I would be sharing what updates are happening. Before starting, I thought that I should be sharing this observation so that everybody becomes aware what lung plays in our day-to-day life. Till the time you, as mentioned by the previous speakers in the inaugural session, everybody is healthy, they are pumping iron, but they are not aware about the lung, what is a healthy lung, which whatever lung they are having, they usually smoke and they don't take care of that. The students are there, you see that if you are having respiratory ailment, you don't bother to take care whether the infection from your throat will go to the lungs or not. You just continue working till the time it inflames your alveoli and it symptoms of pneumonitis and other things comes up and you have to land it to an hospital. So that's why awareness about the lung things happen, and we are very much conscious of the fact. And COPD is one of the leading cause of death in the country. It is affecting, as we are having I think triple burden of disease. One is communicable, non-communicable, and the third, the RCH burden of. We can't say burden of disease, but RCH problem is there. Another thing is been added is the emergency and the traumas, which have now become the fourth burden. We have to handle that. We are conscious about the fact that we are seeing that how the things are moving and what the government and other things. They are very conscious of the fact that these are the 4 areas where all work has to happen. If you look at the programs, we have a national program for non-communicable disease, which have guidelines for respiratory ailments and the chronic obstructive pulmonary disease. In this program, we have created a network of public institutions. We are trying to rope in the private also. If you look at the biggest public-private partnership which the government is having, which would be addressing the COPD and other cases, is your PMJ program or any of the health insurance schemes that the state governments are having. That's another initiative which is there. That means we are very much conscious of the curing or the treatment part of this people getting lung infections. That's one thing. The other program which my previous speaker have mentioned, that's a national TB elimination program. We have preponed the SDG commitments and we are trying to see that how we can reach the elimination goal by 2025. Many things have happened in the TB elimination. We are moving in to a path towards elimination. Let's see that how we do that. In the rural areas also, many initiatives are happening. That the SARS program is there to raise awareness about the rural population. Then apart from that, if you look at the tobacco and the other thing, that's a different altogether. But we do have an anti-smoking laws. The vaping is also banned in the country, but still people, they vape. And they have been, the moment the government starts banning the tobacco, the repercussions which I had around 40 complaints made. So for what? Because I am a public health person. When I'm seeing a public health problem, I need to raise that issue and see that what are the effective steps which need to be taken. That's one thing. But that will not resist me. But as a public health professional, whatever in the interest of the public we can do, we could do it. The anti-smoking, slowly and slowly now, as mentioned by Mishra ji, that previously you would have during the break, you would have seen 5-6 people from the faculty or the audience going out and smoking. Now this time, fortunately, we have not seen anybody going out and smoking. During the meetings also, we would have seen, after 5 years back, you would have seen people, they are going out for a nicotine break. They used to say, and they used to relish also think that we are going for a nicotine break. That's one thing. That from the efforts which have been made, at least that kind of awareness and that kind of change, behavioral change is happening. And behavior change, remember, is very difficult to address. We can inform the person, we can raise awareness, but to translate that awareness into behavior change, it takes time. And efforts are being made in that direction. On the infrastructure also, we do have an infrastructure. Public infrastructure is very, it's a more or less systemic way. We have expanded it. You name, we have reached up to a population of 3,000 to 5,000, where we are having an institution. But before that, I will just say that we have sailed a journey from disease to health, from health to wellness, from wellness to well-being. That kind of paradigm shift is happening in our way of thinking. Previously, all the things are focusing on disease. Now, after disease, we have started talking about health. We had the mandate that the health for all was there, then the Millennium Development Goals were there, then the Sustainable Development Goals are there. Now, to achieve that thing, many efforts have been made. One of the vehicles for making a change for achieving the Millennium Development Goals for the National Rural Health Mission, which subsequently became NHM. Now we have to address the issue of reaching the Sustainable Development Goals, for which now we are adding more intense mechanisms to do that. We do have National Health Mission, which is more done in a renewed way. Second thing is your Ayushman Bhav program, which is having 4 pillars. One is for the comprehensive health coverage. Previously, the strategy was the primary health care strategy. Now we are having a comprehensive primary care health strategy, wherein we, instead of assuring that the lowest most institution which I mentioned, that is at the 3,000 population, from there previously we used to give an assurance of 6 services. Now we are giving an assurance of 12 services, including the wellness part. That means wellness for yoga, wellness for pranayam, and wellness for this. That means from that level we are trying to see and address and see that the people become healthy from that angle. So the government is aware, and we are making strides in that direction. And that institution is now upgraded and known as health and wellness centers. Through that, the wellness component is basically aimed at bringing in yoga and other things into the day-to-day practice. That means at that population, which serves to around 5 to 6 villages, we have been trying to address this wellness component there. Then above them is a primary health center where you can have the treatment of the primary ailments, and then we do have the community health center. Then above that, the district hospital. And most of the district hospitals now, there's a plan that all the districts would be having one medical college. We have always been talking about the board committee, which envisaged to have 2,000 bedded hospital at the community development block. But instead of that, but to realize whatever was the thought process during 1940s, we are making strides in that direction. Now we do have at the block public health level, we are having a block public health unit would be taking care of the other aspect, infectious disease aspect, and the other aspects. Then there are other efforts also. Instead, we are not only focusing on health. Now we do have some efforts and the mechanism in which we are trying to address the social determinants of health. If you talk about the national health policy, apart from providing support to health system strengthening, we are trying to address the social determinants of health also. So as Dr. Khilnani ji has mentioned, that the Ujjwala Yojana, because smokeless previously, that before the Ujjwala Yojana, if you go to any rural household, you would be just, if you being from the community medicine side, if we go to the village for doing some household survey or you want to interact with the person, then unless the If the person is cooking there during that time, then unless you are used to the smoke, you won't be able to enter the house. Now that situation has been taken care. The second thing is during the COVID time, you have seen that the housing was the biggest challenge in the urban areas. Apart from that, the urban population is growing, and yesterday we have been released a draft NUHM 2023 framework. This talks about how to deal with the environment, talking about health in all aspects. That means if you are planning for traffic, you have to talk about health, how you are able to take care of the health aspects of the people. If you are trying to talk about sanitation, you have to talk about health there also. If you are talking about air and the air pollution, you have to see that how these factors have been this. That NUHM 23 framework would be more or less reflecting on that. That is available on this. Yesterday there was a conclave and we could release the draft guidelines for this. That's one thing. Other thing is the Swachhata Abhiyan and other thing. In the urban areas, I was talking about the densely populated and the housing is a problem there. In this housing, what we are doing, you see that the focus of the PM Awas Yojana, which is there, so it is at least to have a area so that the density of the population at least can be dispersed and distributed. Otherwise, it would be challenging for lung disease if a densely populated area is there. You see that. If you see the sanatorias in the hilly terrains, in Uttarakhand, you have a lot of sanitarias, Himachal sanitaria. The population which is coming and utilizing that sanatoria, though the sanatoria concept is more or less getting obsolete, but still it is there. Recently, I have visited there. I could find 60 people undergoing TB treatment, all for hemoptysis and complications. That sanatoria are there, many dignitaries, they have also got treatment there. So that kind of mechanism is there, but we have to see that how we address that issue of housing so that the densely populated area and the government is having a Awas Yojana and other in one way or the other. The other thing is smart cities wherein they are promoting the wellness component more. They do have built in the smart components into that. Then the framework which I've already mentioned. These are many of the initiatives which are happening, but the individual needs to be made aware that he has to protect his lung and take care of it. Unless we will only become aware when we are having some ailment, otherwise we are not aware because many of the body ailments are not aware till you either by your yogic experience you become aware about that, or if a disease happens, then only you are aware about that. I will stop here. So thank you very much for listening.